This is Fox 9 Now.
Thanks for joining us, everybody. I'm ROLAND. Tonight we begin with a rare perspective on the pandemic, a look inside a local ICU. Now, we've been reporting on COVID-19 cases, deaths, and the impact to the community for the last 18 months. But today, we're letting you see it for yourself. Our Karen Lair takes us inside the intensive care unit at St. Alphonsus, where healthcare workers say they're overwhelmed, they're exhausted, and demoralized by a pandemic that could have been avoided.
It was an eye-opening experience to be able to see firsthand how fellow Idahoans at this very moment are fighting for their lives inside the intensive care unit. Doctors and nurses here at St. Alphonsus and at hospitals all across the state are continuing to treat an overwhelming number of COVID-positive patients every day.
Large majority of our patients are COVID positive.
This is just another day for ICU Medical Director Dr. Megan McInerney.
So in the ICU right next door, I just rounded on a 27-year-old female, COVID positive, unvaccinated, intubated.
That's becoming more and more common. Most patients in the ICU are here because of COVID-19, and a vast majority of those are unvaccinated.
You know, we're used to death all the time in the intensive care unit, but now the death feels so much heavier because it's preventable.
Doctors and nurses here at St. Alphonsus still see COVID patients in their 60s and 70s, but during the current Delta surge, the average age of hospitalized patients is getting younger.
The much more common ages that we're seeing are 40s and 50s, and then every once in a while, somebody in their 20s and 30s.
As Dr. McInerney puts it, if you're sick enough to meet her, your outlook isn't good. She can't even count how many patients she's personally seen pass away since the start of the pandemic, but now it's happening on almost every shift.
Yesterday, we had 5 patients die in our hospital from COVID, just this Boise hospital.
Some lose their battle with COVID, overwhelmed with regret, wishing they would have taken the pandemic seriously and gotten vaccinated. Others, even as their condition worsens in intensive care, continue to deny their diagnosis, insisting COVID is a hoax.
I had a patient last week that told me that it still wasn't real and it didn't change anything that we did. I mean, we're still going to care for the patients.
There is a lot of negativity out there, a lot of belief that we're somehow involved in a conspiracy theory with Fauci and Big Pharma. And I definitely want to punch holes in that theory, because our mainstay of therapy is cheap old steroids, and we do not see extra kickbacks. There's no incentive to attribute a death to COVID. What we're doing is trying to save lives.
It's also important to note St. Alphonsus serves as the trauma center for the entire region, receiving patients after accidents or injuries in need of surgery or life-saving treatments. That doesn't change in the middle of a pandemic.
We're the regional trauma center, so we're getting a bunch of traumas.
During our interview with Dr. Andrew Southard in the emergency department, a code blue was called in from the COVID ICU.
So right now the code team's mobilizing. We've got 2 physicians on, so one of our physicians is going to take a ER nurse and a pharmacist and one of our techs. We go upstairs with our special equipment we have, and we can run a code, basically a cardiac arrest, anywhere in the hospital.
With the influx of patients comes a need for more space. Areas like this storage room are now used to treat up to 6 patients at a time, a space that used to house patients immediately after standard surgeries on the verge of being converted into another intensive care unit. While the additional space will help, these healthcare workers wish it wasn't needed.
No one is making it up. No one's doing it just for the money. We honestly would all prefer if COVID never happened.
And to keep yourself out of the hospital, be smart, stay safe, and seriously consider where you get your information.
Do you want to believe something you see posted on Facebook, or do you want to believe an ICU doctor who's doing this every day and has been doing this every day since this started?
Karen Lair, Fox 9 Now.
This is Fox 9 Now.
Thanks for joining us tonight. I'm Jake Garcia. Tonight's top story, it's a heartbreaking scenario playing out in Idaho hospitals every day. Patients are dying from COVID-19. Many of those patients feel regret over their decision not to get vaccinated after it's too late. Tonight, our Karen Lair takes us inside the St. Alphonsus Intensive Care Unit, where the daughter of a patient currently on a ventilator is urging the community to take COVID-19 seriously.
It is a roller coaster from hell, to be honest.
This is a difficult day for ERICKA THAYNE. She and her sister are at the St. Alphonsus ICU visiting their mom, who's been hospitalized with COVID-19 for the last week and a half.
I've been physically ill over the information I've had to give to my dad and to the rest of my family, it's just real heavy.
ERICKA's mom is in her 50s and unvaccinated. After urging older family members to get the vaccine months ago, she'd only recently made the decision she wanted to get the shot herself.
Then it was just too late.
It wasn't just ERICKA's mom either. She says the virus spread through her entire family like wildfire. Some were vaccinated, some were not.
Everybody got it. I got it, my sister got it, my husband, her husband, my dad had already had it, my grandparents, they had it. Then those that were vaccinated, they had very few symptoms.
ERICKA is not vaccinated. Like her mom, she felt she wasn't at risk.
And then of course I'm young, that's not gonna happen to me, which is stupid because I did get sick and it was terrible. Fevers and chills and delirium with the fevers and chills, coughing and all sorts of things. And I got lucky. Like, it could have been a lot worse.
For ERICKA's mom, it was worse. She was admitted about 10 days ago through the ER and has been sedated and paralyzed for the last week, unable to communicate with family members fortunate enough to visit in person.
Fortunately, right now, they're letting 2 of us in at a time, which is a huge blessing. There's 4 kids, and my sister lives in Washington, so she's actually going to fly in and come see my mom with my brother tomorrow.
ERICKA's mom is just one of dozens of Idahoans currently being treated at the St. Alphonsus ICU. During the current Delta surge, the patients are getting younger.
So in the ICU right next door, I just rounded on a 27-year-old female, COVID positive, unvaccinated, intubated.
Dr. Megan McInerney can't even count how many patients she's personally seen pass away since the start of the pandemic. On Wednesday, 5 COVID patients died at this hospital alone. For those who make it out of the ICU alive, the road ahead isn't always easy.
For those lucky people who don't die, a lot of them will have what we call long-term sequelae, right? Long-term side effects, long-term symptoms from COVID where they might be more short of breath just walking around.
Now, while ERICKA watches her mother breathe through a machine, she wishes everyone would just put politics aside and take the pandemic seriously.
I'm one to admit that, I don't like to be told what to do. I don't want mandates, but we each have a personal choice, and if you want to choose to have a loved one on a ventilator, that's a choice, but from experience, I would say not my first choice.
ERICKA calls the entire experience humbling, now feeling a sense of regret, urging those who will listen to get vaccinated.
It's crazy what COVID can do, and if there's any hope at all in the vaccine, which we know that there is, it's proven now, just take it, just get it done. The risks versus benefits, definitely there's way more benefits.
Karen Lair, Fox 9 Now.
This is Fox 9 Now.
Thanks for joining us tonight. I'm Jake Garcia. The pandemic isn't over. That's the message from exhausted healthcare workers across the Treasure Valley, as Idaho case counts and hospitalizations remain the highest of the entire pandemic. Our Karen Laird talks with doctors at St. Alphonsus about the toll it's taking on staff.
If you're sick enough to meet me in the ICU with COVID, you have a high likelihood of dying.
That's the sad reality of the current situation 18 months into the coronavirus pandemic. Unfortunately, staff are accustomed to seeing patients die in the ICU, where a majority of beds are now occupied with COVID-positive patients who chose not to get vaccinated. At this stage, Dr. Megan McInerney says the deaths feel heavier because now they're mostly preventable.
Sometimes patients will still say, I don't care what you tell me. I still think the vaccine is a hoax. I don't even think COVID is real. And that's always hard to take.
I had a patient last week that told me that it still wasn't real and it didn't change anything that we did. I mean, we're still going to care for the patients.
Still doing everything they can to keep this number climbing. This sign greets hospital staff as they enter the building at the start of their shifts. It changes regularly, reflecting the number of COVID patients treated and released from the hospital.
The healthcare workers here, the physicians, nurses, techs, I mean, they went into healthcare to help people and to try and save people's lives. When you go home and you hear things like the virus isn't real or this is made up and people are just doing it for money, it really gets to the core of who these people are.
And that's tough to tolerate after working multiple 12-plus hour shifts a week.
The reality is, a very, very burned out team.
Healthcare workers, once celebrated for their service, now feeling exhausted, overwhelmed, and demoralized.
I know the balloons and banners of 2020, that was fantastic. We don't need that now. What we need is just to hear that you still believe in us. What I'm seeing across the board, nurses, CNAs, respiratory therapists, pharmacists, physicians, both inpatient and outpatient, is that they're pushing it to the max.
If there's a case where we're all rushed in and the patient is young and we're doing chest compressions or trying to save somebody, you know, when you close your eyes, my brain will sometimes try to reintroduce those visions over and over again. So similar to how people describe PTSD.
And still, they keep coming back day after day, only to leave work and see Idahoans who aren't taking precautions to keep themselves out of the hospital.
I guess it's just been a little frustrating because people are, not masking, they're not taking any precautions, or there's new, concerts or events that are going on that weren't there last year, which are making it a lot harder for people.
So how can you help? Listen to the experts, take the virus seriously, and thank a healthcare worker for their work and dedication during this difficult time.
If I could do anything, it's just show them that, hey, this isn't over. Like, people are suffering day in and day out, and we're trying to do the best care we can, but we only have so many resources to do that.
Karen Lair, Fox 9 Now.